and it's been quite a journey for us with these three events. I'll just move the slides on. There we go. There we are. As you know by now, our purpose has been to increase, as I mentioned, IRC cooperation amongst social prescribing stakeholders in research and practice, and the purpose of the network was to support open discussion and collaboration in order to see if we could identify those hard to solve problems, those research priorities, and then take some of those priorities forward and see how we could actually work together across Scotland, Ireland and Wales. And as you know, this is the third event, as I mentioned. The first one was a showcase event. And the second one, we developed the research priorities, and Simon's going to present on those in a few minutes' time. This one is about moving forwards. Which priority do we identify as of interest to us, and one that we can work together on? Now, as you know, we record these events, and just check in now, Lisa, that we're recording on this one.
Yes, we are.
Yeah, lovely. And so if you have any objections, please let us know. The recordings will be available on YouTube, and links and PDFs to the report that we develop at the end of this third meeting will be made available to you. So today our aim is to present the findings back to you from the last event. Our purpose is to agree one or two priorities for taking forward after we've had a discussion about what these priorities mean to us, or you, as practitioners and researchers. We've got an agenda which you probably already seen, but here it is. As I mentioned, Simon will present the GCM research findings. I'll give some information on what we know about these priorities to date, and then the plan is to have some form of structured discussion about what these priorities mean to you. How do we think we can work together to solve these problems, and which two research priorities, or just one maybe, do you consider as most important and feasible, regardless of what the activity told us in the second event? Actually, it's which one have we got the most passion about? Which one do we feel most passionate about? So we've also invited a colleague of ours, Sue John, to have a chat about identifying research funding, and she's going to bring some knowledge about some calls which may be available to us. And of course, that's a tricky one, because you know, obviously funding, some funding is available to Ireland through the European Union, and obviously not for us in Wales and in Scotland. So there are some hurdles there to consider. And then we'll agree next steps going forward. I just wanted to remind ourselves about what we consider social prescribing, and this is the slide that I put up on the other two occasions as well. And it's, for us, the definition, the working definition that we're using is social prescribing connects citizens to community support to better manage their health and well-being. And as we know, there are multiple ways in which people do that. through GP visit and referring to a link worker, self-referral, or through contact through social services, allied health professionals, etc. And of course, there's that what matters conversation, that's action plan development, and the referral to the activity in the community. So having said all of that, that's me finished for now, and over to Simon, who's going to talk us through the GCM research priorities, activities, and the findings. Thanks, Simon.
Okay, no worries. I'll just share my screen.
Okay. Oh, there we are.
Yeah, can you see that okay?
Yeah.
Yep. Okay, so we did 3 things with you all. So we collected what you thought the research priorities should be. We sent out a link to a brainstorming task and asked you to input what you thought the research priorities were, or what they should be. And then in the second session, we got you all to sort those statements into groups and then rate those statements by both importance and feasibility. So the analysis of all of that has thrown out a few different ways to look at the results. The first thing that we're looking at is the results from the sorting. So we produced a cluster map, and this isn't sort of set in stone map. It's really it's on a scale from, I think you can have 1 to 15 clusters, and then it's up to the researcher to interpret the statements that are there and see how the clusters best group together. So the software, generally it's around sort of like between 5 and 8. So you can look at the various scenarios and see which groups represent the data the best. So 6 clusters seem to represent the data the best. So I've changed the titles slightly. It does come up with a suggestion of titles, but based on the comments or the statements that are in each cluster, I've changed the titles to represent those various statements. So in no order of importance, we have measuring efficacy of social prescribing, demonstrating the value of social prescribing via case studies, social prescribing for children, young people and individuals with chronic health conditions, improving community connection and engagement, and improving peer support link worker training, and clarifying roles and responsibilities of link workers. So I think for those of you that attended session 2, Carolyn showed the top 10 rated statements at the end. And this is another way of looking at that data. So you might see later on that some of these clusters sort of correspond with some of those statements that are in the top 10. But really, it sort of like distills the data down into sort of 6 groups, really. How you guys thought this these statements were best grouped together. So onto the rating tasks. So they were rated for feasibility and importance. So this this pattern matching diagram actually it shows those clusters and how the scores of the statements within the clusters correspond with your ratings of importance and feasibility. So this is a relative scale. So the scores are the collective scores that were given, or the average scores that were given. So you can see actually, improving community connection and engagement is quite high on importance and feasibility. whereas measuring the efficacy of social prescribing is still very high on importance, but in terms of feasibility, it's not quite there. And then, as you can see, social prescribing for children, young people and chronic health conditions. This one is rated almost just as important as demonstrating the value of social prescribing via case studies, but demonstrating the value of social prescribing is actually much higher in terms of feasibility. It's a lot more achievable than investigating social prescribing for children, young people and those with chronic health conditions. And then right at the bottom, for importance and feasibility, you have clarifying the role and responsibilities of link workers. So another way of looking at that is on an absolute scale, where the top and bottom ratings are adjusted, and here you can see actually pretty much everything that is rated for importance is rated higher than what is feasible for that particular cluster, except for demonstrating the value of social prescribing via case studies. So that's actually a lot more feasible than it is scored as for importance. So we've also, oh, this is wrong. So we've also depicted it where, oh, sorry, I've drawn a blank and forgotten what you call this diagram.
Go zone.
Sorry?
Go zone.
Oh, the go zone, yes. So we also, thank you. We've also depicted it as a go zone with importance on the x-axis and feasibility on the y-axis. And this bright green section up here is those that are termed the most important and the most feasible. And those ringed in red here, these are the 10 that score the highest for both feasibility and importance combined. So I think this is the list that was shown at the end of session 2. So you can, if you have a quick read through the list, you should be able to see that some of these correspond with, oops. Okay. Okay, some of these correspond with some of the groups or the themes that were identified in the sorting task. And then, so finally, to help stimulate discussion, I put a list of the 6 groups, the 6 themes that were identified. So improving community connection and engagement, measuring the efficacy of social prescribing, and then demonstrating the value of social prescribing via case studies, social prescribing for children, young people and chronic health conditions, clarifying the roles and responsibilities of link workers, and improving peer support and link worker training. And these are listed in order of the importance that they appeared in the pattern matching diagram. And then I've included the 5 top statements. I can include the other 5 if it's helpful. So really, it's I think it's up to everybody to have a little look and say how they feel these statements align with what they wish to pursue, or what they think is probably the most achievable for everybody to pursue.
Thanks, Simon. If you unshare.
Yeah, of course.
Yeah, and then I'll share because if anybody wants to put a question in the chat, then please do so, because what I'm going to do now is I'm going to going to start talking about those five those five priorities. And the first one, and this was the one that everybody was quite enthusiastic about in the last meeting, why some people fail to engage in the activities to which they've been referred. And it was quite interesting. Last night as I was preparing the slides, you know, the question to me was, what do we know about the priorities we've identified? Well, you know, just by doing it was a quick and dirty search of the internet. I you know, wondered, you know, had there been any research around this topic area in social prescribing, and I'll be honest with you, I couldn't find any. And that led me to wonder whether or not, you know, the terms that I used were correct. You know, what terms should we be using? I use the keywords absenteeism, did not arrive, DNA, non-attenders, and social prescribing, and as I said, I didn't find anything at all around any articles that have been written around this topic area. And I appreciate this wasn't a systematic approach at all. It was just me having a quick look. And we would need to do a proper review if we were going to decide on moving this topic area forward. But from the conversations that we had in the last meeting, it did seem that this was of interest to everybody. So I started to look alongside to other areas across health and social care to see if there was anything around community clinics that written around absenteeism DNA. And this is an old paper, but I thought it was quite useful in triggering some questions. You know, what are the fail to engage rates? It'd be interesting if Elemental were here, if they could tell us what the fail to engage rates were across social prescribing as they know them. And of course, you know, that's one of the issues that we've got, is that, you know, not everybody's got that type of platform in order to collect the data. What I did, as you can see, what I did find were some questions around, do people just simply forget to attend? You know, is there a difference in age range as to who engages or not? And would pre-appointment reminders via mobile text messaging, phone call or email help? And of course, today in our everyday lives, you know, if we go to the GP or we have our COVID jabs, we always get a reminder. At least, you know, where I live, we get a reminder on the mobile phone to attend. So are those sorts of things happening? Would they help? Incentives to attend. This particular paper talked about providing talked about providing an incentive, but actually its main thing that it talked about was the asking people to pay a 20 euros to attend, and then they get the like a deposit, and failure to attend, they lost the money when and if they attended, they had the money returned. They talked about a buddying system. You know, some people find it difficult to attend appointments, clinics, or even activities because they find it difficult to, you know, going on their own. And so a suggestion in this particular paper about taking a member, family, or a friend with them to an activity. So there are things written in other areas of health and social care around this topic area, but it doesn't look, as far as I can see, that there are any peer-reviewed articles written in social prescribing around failing to engage. But as I said, that was a quick and dirty look and it wasn't something that and would warrant a systematic approach in order to identify a really, to be able to say that's a hand on heart. So the next one, long-term impact on outcomes. And of course, NASP has provided briefings on outcomes, and as they says there, the evidence suggests that social prescribing can have a positive impact on a very wide range of outcomes, including decreases in loneliness, improvement in mental health and social connection and overall well-being. But there is less evidence on the medium long-term impact of social prescribing, and they, NASP, the National Academy of Social Prescribing, based in England, state that research is required in this area. There is also no consensus on what constitutes medium to long-term outcomes, but they do offer a suggestion that short-term is up to 12 months, medium-term 13 to 35 months, and longer-term longer than 36 months. And out of in this evidence, a summary of evidence that they produced, Polly et al., the 245 papers were reviewed, and they said that there were no papers reporting outcomes for crime, legal, welfare, and there were or modifiable risks or spiritual well-being. Now, Professor Linda Ross at the University of South Wales is leading a piece of work to develop a spirituality module for social prescribing, teaching and learning, and she's just applied for funding, for Keith funding, in order to take that forward. She's well known in the area of spirituality, in particularly around nursing, and had identified this gap and came forward to discuss that with us. So certainly, there's an area here for consideration. The next slide. How can social prescribing support people with different chronic health diseases, diabetes, cancer, etc.? So Basker et al. States in their paper that the social prescribing model seems to offer a promising strategy for advancing lifestyle medicine, and the World Health Organization toolkit for social prescribing also lists people with chronic conditions as a population which is most likely to benefit. So again, this is an area where we could consider working together, and I'm sure there are many of us within the call that would have a particular interest in certain chronic conditions and would really be able to focus down on in this area. There are papers written in some of these topic areas around individual chronic conditions, and there are also papers written around coaching and coaching people to self-care with a chronic condition. So worth considering. Again, how is change measured? Well, we have a number of measures suggested by the World Health Organization toolkit, which has been published this year. They are very clinical, and of course, I would add that we need to consider social well-being as well, and our own social South Wales social well-being scale. I would add to that list. For those of you interested in seeing more about the SUSUBs, as we call it, we'll be launching it this year at one of our forum events at WISPR. So if you are interested, of course, please contact us. So social prescribing can be measured in various ways. Needless to say that monitoring and evaluation are very important. And if we're going to ensure that we build the evidence base and improve the services we've developed, then we need to promote monitoring and evaluation and the use and also consider how we measure at multiple levels of the system. So social prescribing. Does social prescribing have a long-term benefit for health and socioeconomic opportunities? Well, it's a good question. We already know that that more evidence of long-term outcomes are required, and also of wider determinants of health. And as it says there, our health is closely bound with social and economic aspects of our lives, from where we're born, live and work, to our educational opportunities, income and influence. And these social factors lead to inequalities in health and well-being across different people and communities, both in access to healthcare and in the opportunity we have to live healthy lives. And again, there's a link there to the NASP evidence on the role of social prescribing in addressing health inequalities. So having had a very, very quick and dirty insight into there are definitely gaps, there's definitely work to be done. The question is that what do these research priorities mean to you? And please feel free to put some questions in the chat if you feel more comfortable doing so. But I really want to throw it open now to those of you here and ask that question. What do these research priorities mean to you? And you know, do you think that one is more important than the other? And how can we work together to solve these problems? I'll come to these now, and then perhaps we can start to have some discussion.
Would it be helpful if I showed the clusters and the top 5 priorities?
Yes, I think so.
Yeah.
Okay, anybody want to offer some opinion on all of that? Sorry, beg your pardon, that was my phone went off.
I think it's interesting that improving peer support and link worker training was rated as the least important when it comes up in the literature a lot as something that needs to be addressed. So
and maybe that's because it is being absolutely done to death at the moment, maybe.
Yeah.
Deirdre?
Yeah, I think it's really interesting, and thanks, Millian, for putting it all together. I think just looking at some of the topics, and that's maybe where the improving peer support falls into it. To me, some of them seem more natural research questions, and some of them are more related to kind of service development or, you know, improving kind of social prescribing services and supporting people involved in social delivery of social prescribing services. You know, so for example, and I think when I was doing the prioritizing the last time, I kind of had a little bit of difficulty in some of the statements, you know, things like clarifying the role and responsibility of link workers. You know, obviously you can make anything into a research question, but is some of that around, you know, the people involved in delivering social prescribing, deciding kind of, well, what are the boundaries around a link worker? And the same with that whole idea of the training. You know, I think part of that is a needs analysis around kind of, well, what is it link workers want? in terms of developing training programs. It just that struck me.
Yeah, I think that's a really interesting point, Deirdre, because I think what we've got here is we've got two parallel worlds emerging. One of the the developing professional and service group, and by golly, they are at that early stage, aren't they, where they, there are discussions around registration, there are discussions around what is this role of the link worker, what is this pathway, what how do they interact with other professional groups, sectors. There's all of that going on at the same time as actually they want evidence, and people want evidence, and so we've got this mix of and it's a very unique situation, I think, whereby you've got this mix of these early service developments ongoing, and researchers who are very keen in this area and trying to build this evidence from scratch. And so you do end up with this situation, don't you, whereby some of the questions that come out, some of them are not, as you say, not research questions, but they are about service development and so forth. But I think it's because we find ourselves in that unique situation.
Yeah.
It's a lack of maturity, isn't it?
Yeah, exactly. And I think that's partly, you were saying some of the areas you were trying to find literature on, and you didn't find any. And I think, it's such an early area of research, isn't it? So the whole idea of even that piece around why people fail to engage, I don't think anybody has looked at that.
No. I mean, and that's an opportunity as well, isn't it? It's an opportunity because that's somewhere we can take forward and think, and make a difference.
Yeah, and sorry, I don't want to dominate the discussion. So I'll pass over. Just my last comment was that, you were saying we don't know the rates of non-attendance. I know the research that we've been doing here in Dublin, the rate of non-attendance from the referrer to the link worker is actually very high. And in our research, it's showing up around that, 60-70% of non-attenders. So I think there's really important research to do around that whole area of non-engagement. To get to find out reasons and how that can be addressed.
And what were the reasons that you uncovered? Have you found? Are they?
They're very variable. Again, it's hard from a research ethics perspective, isn't it? To go, you have to go back and say, well, now can I talk to the people? Because we always say, well, we want to talk to the people who attend, but I think we have to go back and get that ethical approval. But what the link workers have told me is that a lot of people say, oh, well, the GP felt it was a good idea, and I just agreed with him or her. They didn't like to kind of go against the GP, and then other reasons were things like, I'm just not ready. I'm interested and I think it's a good idea and I would like to attend, to be more linked with my community, but I'm just not ready. And then it becomes the link worker making the assessment. Well, how often do I go back to this person to support them? And then at some stage calling it. And then sometimes it was around where the link worker was based. The service I'm connected to is from a very disadvantaged area, and people will have certain perceptions around attending maybe a service within that area. So that can be off-putting, and transport issues. So there's a lot of different reasons coming out, really, Carolyn.
I think that's. Apologies, my camera has been on and off today because of network quality issues. I'll give it another go. The transport issues have come up a lot, and I know Mary Lynch is on the line, and I know she's done a lot of work on transport in issues, but in particular in North Wales. And Mary, are you there?
Yes, I am.
I think you did a study. Was it last year, the year before? Oh, no, 2 years ago, 3 years ago now.
Yeah, it was one of my colleagues, Ned, and he basically, it was a social return on investment on rural transport, and it was about people, you know, the value that people placed on accessing transport in rural areas and to meet their health needs. And ultimately, the report and the return on investment was that it was of social cost benefit impact, and it actually had a return on investment for people from a social perspective, as well as the provision of accessing services and gaining access to those, and the receipt of health benefits associated.
Thanks, Mary, because I mean that's just one. I mean, all of those things that you mentioned, Deirdre, are massive in themselves, aren't they? You know, and clearly the transport issues would be quite a major focus point.
Carolyn, can I
Yeah.
just say something as well?
Yeah, carry on, Mary.
Only I'm just back from I've been just back from Ireland, and I was up in Northern Ireland, and transport is a big issue, but equally having access to rural transport, specifically, which is subsidised and available through voluntary organisations. They have, for example, in Fermanagh, they have a community transport link, which individuals apply for to become members, and therefore then they can book, dial a lift, etc. But that actually improves social isolation and gives people sort of control and capacity over their accessing, as they would say, healthcare, but that's very specific to rural areas as opposed to urban areas. And I know there's a geographical spread, but that was a collaboration with the Department of Agriculture and Rural Affairs to do that as well. So it's about, I think, really in relation to social prescribing, I think a lot of what we need to do is look at taking a transdisciplinary research approach to how to address the needs and the health needs, or by non-clinical interventions, for people residing in both urban and rural areas, trying to understand what their unique needs are, and how do you raise the awareness of social prescribing within local communities so that people can be self-referring as well as being referred through GP practices or third sector organisations. And it's about communicating that awareness, I think, is the big issue. To engage people, to empower them to make the decisions, to participate in activities. And is that going through and having that link that we had, for example, with Sally Rees, in taking on that? Is it about partnering with the volunteering sector, third sector organisations to raise that awareness? It's just a thought.
I think I think that's quite an interesting thought as well, because as you were talking, I was thinking about, you know, the looking at these statements and where what about public involvement, public knowledge about social prescribing? That Simon, did that come up at all? Simon?
Yeah, sorry. Do you mean, did it come up in the statements?
Yeah.
No, I don't think that came up in the statements. Can have a quick look if you want.
Yeah, have a quick look, but because it's interesting, isn't it? Because I know, Mary, you and your students have done quite a bit on co-production with working with communities as and the importance of engagement with the public. But if the public are not aware of what social prescribing is, then then we're on a hiding to nothing, really.
Yeah, well, put it this way, there is a report, and I will send it to you, Carolyn. Was done on social prescribing in Scotland, and a big thing that came out of that was, yes, there's a lot of activity on the ground, but unfortunately, the problem is that there isn't an increased public awareness of what is social prescribing. And until you get the community or the public to understand what social prescribing is, it's very hard to engage people within the activities. So that was a key thing from that perspective. But there is a lot of people who are doing a huge amount of really, really good work around the area of social prescribing. Unfortunately, it's how do you raise that awareness, and maybe the fact that, you know, in building social capital through the likes of volunteering, Ireland, the VDA in Northern Ireland, the various networks within Scotland for social prescribing, that really, if it was about sort of promoting it from as a non-clinical intervention to improve mental health and well-being, or physical health and well-being, that it is an alternative that will benefit people. I think that's the way forward. But maybe using the sectors like we have in Wales, there's the volunteering end, but equally in Scotland there is that third sector volunteering end, as well as in Northern Ireland and in the Republic of Ireland. So maybe linking with the volunteering it's structured would be a way to do it as well.
And all of this, I mean, it may appear to some people that we're going off on a tangent here, but actually it's all related to this actual question: why some people fail to engage in the activities which they've been referred to. Because if members of the public don't know about social prescribing and weary about it, then of course they're not going to attend, because they may not feel it's a legitimate alternative to what they originally thought they wanted via the GP. It seems that unless anybody else has got anything to say, it seems that this topic area may be of interest to not only us as researchers, but actually to practice as well. Now, I noticed that a few people have to leave at 2 o'clock, and I know Sue John has joined us, and Sue is our colleague at the University of South Wales, who's going to give us some indication as to what grants may be available. And of course, this is a tricky area, needless to say, because of the political situation that we find ourselves in Wales and in Scotland and yes, and the rest of the UK. Let's not go there. You know, I'm trying to avoid the B word. Sue, thanks for joining us. What have you got to offer us as salvage in this area?
Okay, I'm going to be honest, straight up, not a lot, Kathleen, I'm afraid.
No, I didn't think so, no.
Not a lot, I'm afraid. Yeah, so hello to everybody who's on the call. My name is Sue John. I'm a Fund and Development Manager at the University of South Wales. Part of my role is to look for potential funding streams, do some scoping, etc. for people. I've spent quite a long time trying to look for some funding opportunities here, and I'll be honest with you, I'm not coming up with much because this does seem such a specialist area, and it does sort of fall between both the social and the medical area, you know. So what I've done is I've put together, and can I apologise for the slides that you're seeing because they're very basic, they're not branded, and I'm afraid I've just been typing them quickly. So Lisa is kindly sharing these for me because I've got some technical issues. I've basically done a trawl of everything I could think of. Now, you as practitioners, you probably know far more than me about these funders and within these areas, but what I've done is to put a few slides together just to try to highlight where I think there may be opportunities, but clearly those opportunities will need far more examination by yourselves to see if you really think there is anything there into which you can fit. Do you want to pop to the next slide, Lisa? Please. Oh, we've lost it.
We've lost it. Oh, coming back.
She's better at it than me, though.
No, it's gone again, Lisa.
So I can sort of, I can't remember what order the slides were, but I can sort of, are you going to try again, Lisa, or?
Yes, trying again.
Oh, thank you. There you go. Cool. That's fab. Thank you. Yeah, so we've had internal discussions around any potential within Horizon Europe and European funding for you. I'm speaking to the converted here. You probably all know that the big issue with Horizon Europe is the fact that the UK hasn't associated to the Horizon Europe programme, which is a huge issue and a huge disappointment for all UK institutions. Basically, even if we had a European partner that could lead an application on behalf of the consortium, the UK partners still would not be in a position to draw down any grant from the programme. So that does pose a big issue for a lot of us here today. Now, you probably also will have heard of the UK Government Guarantee Scheme, whereby successful applications to Horizon Europe are now being funded through the UK government. However, that guarantee scheme currently only extends to the first 2 calls within Horizon Europe, and therefore there's no guarantee for us after those 2 calls that there would be any money coming from the UK government to subsidise our involvement in any collaborative bids which we carry out with European partners. So there's a real risk there, given the huge amount of effort it takes to put a Horizon Europe application together, of us doing that, you know, and then there being no money to fund that activity. We would all hope, obviously, that association would happen soon. Carolyn has just alluded to the huge political implications that are causing those problems, and the word on the ground with colleagues in my position in other universities and with those in Brussels is that it isn't going to happen anytime soon, unfortunately. That said, I have identified there Horizon Europe. It's highly likely that the sort of thing you're looking at would come under Pillar 2, Cluster 1, which is health. I've provided you with a link there. Look, the programme is absolutely vast. It's absolutely vast. Some of it is very, very prescriptive indeed, and so would be quite restrictive for us. But there are other areas where social prescribing probably could form part of a larger project. Carolyn, you mentioned when we spoke a couple of weeks ago that you had a number of European partners that you've been discussing things with. Yeah,
I do, yeah.
Have they got anything in the pipeline at all that they've been talking about through Horizon Europe?
I was invited to a meeting in Lisbon at the beginning of the month by Euro HealthNet, and there were about 17 countries there in total. They are not quite as advanced as we are within the UK and Ireland, but they're very interested in doing any work with us as a larger, consortium.
Yeah, so maybe that's something we can look to for the future. Let's hope we do associate, and then we can start looking in detail and more seriously at the Horizon Europe calls to see if there's something that can be done there.
Mm-hmm.
Okay, if we can move on to the next one, Lisa, please. Okay, yeah, so as you can see, Wales Island programmes, no specific detail as yet. There is a joint statement and a mention of, the Welsh and Irish governments putting money together to look at some specific Wales Island and hopefully Scotland interventions. There is absolutely no detail out there at the moment around what subject areas that may or may not be in. You would hope that it would be fairly broad. But there is nothing more coming out of the Welsh Government at the moment on that. So I'm afraid I really, really cannot tell you any more than that. I've got somebody who is very experienced in Wales Island. So if anything does come out, then obviously I can let you know. And if the Irish partners on the call hear anything before us, we would greatly appreciate you letting us know, if you heard of anything prior to us, please. Next one, Lisa, please. Okay, so the other place I started looking was, I thought, right, let's just have a look at UCRI. Let's see what's available there. And I don't know if you're all already on this, but UCRI has a funding finder. There's the link there where you can basically go in and filter on which research councils you think your work may fit in. You can do a little search box and you'll get opportunities that will come up. So I've identified a few streams which potentially could be of interest to you, but some that I thought were just worth mentioning as well. So this one, Building Community Research Consortia to Address Health Disparities, it cuts across a number of the research councils, AHRC, MRC and ESRC. A call actually closes today, but there are future calls possible. So I've given you the link there for you to go in and have a look at that in case. Sorry. That's okay, in case there is any potential in the future. I mean, look, a lot of these calls are quite detailed in what you can achieve within them, but they are around research. So thinking about what it is, Carolyn, you explained to me a few weeks ago, this type of thing you want to do. I think these will actually fund research other than just practical interventions. So that might be of use. I also looked at these UCRI mental health networks, and there was some mention in there around the role of social prescribing in relation to mental health and the positive effects that it can have generally with regard to mental health. There are 8 networks and they've received about 8 million in funding from UK Gov. It's a collaborative ethos and they look to bring together a wide range of disciplines, including health, social sciences, medicines, etc. Now, these aren't actually research projects, they are networks, but I don't know if anybody on the call, is anybody part of any of these UCRI mental health networks? Because there's 8 in total and they're all quite focused. Is there anybody that is involved at the moment with any of them?
I'm not.
No? Okay. So they're quite well funded. Now, what I thought was, I'm not sure if there's any mileage in you looking at those networks, because potentially when I looked at the membership of those networks, they're really, really broad and they're cross-sector, bringing together lots and lots of different people. And I was thinking from a bid writing perspective, there's probably quite a lot of strength there. Okay. Around potential partnerships. So I've put the link there for you to see how many different networks there are and whether any of them are of interest to you anyway. I don't think that they're funding, they're awarding body, you know what I mean? They don't offer funding, but potentially they could be working together to develop bids from elsewhere. So I thought I'd just mention those. Can we go to the next slide, please, Lisa? Right, was that, did we miss one? Did we miss number 5? Fab. Now then, I think this is a bit of a long shot. This is the Applied Global Health. So you're looking here at having, you know, definitely European, if not international partners on these. This is about Applied Global Health. So it's looking at the you know, you'd be looking at social prescribing on a sort of European and worldwide basis. So I think this is quite a long shot. It involves the MRC and the Foreign and Commonwealth Development Office, but it would offer you probably the potential to look at where we are against some international partners, you know, and to see if social prescribing is being used elsewhere, to what extent, what are the benefits, what impact has it had. As you can see there, the deadline is quite short, that's the 28th of July. And again, you'd be reliant on having international partners. So I'm not sure that's really something, but I thought I'd mention it. Then the ACRI Health Systems Research Initiative, strengthening and improving health systems in low and middle income countries. Again, I think you'd have to have international partners for that. And that is coming to a close. But what they have put a note up there to say, look, it is coming to close. However, they're really interested in speaking to people still around those interventions. So there's an email address there that you can contact to see if there's any scope to have further discussions with them on that. There's a general one underneath then, just a basic ESRC research grant, but I will say 50% of that needs to be social science based, and I'm not sure. I think, Carolyn, do you think that's too heavy on the social science side?
No, I think it's a possibility because in Wales, social prescribing is based mainly in the third sector and in the local authorities. So yeah. It's a possibility.
I mean, the nice thing about that one is there's quite a broad range of funding available, but it's also bottom up. It's any subject really. You know, it's not prescriptive, so it gives you the opportunity to be quite open about what it is you want to do. You know, and that's just an open call. There's no deadline on that. That can be accessed at any time. You know, we've done quite a few ESRC open research grants. So that could be something that's easier for you, I think. Can we go on to the next slide, please, Lisa? Number 6, thank you. So that exhausted the ACRI stuff. So I thought, right, where else can we look for specific health? So it was NIHR was what I came up with next. I'm not sure if any of you have already engaged in NIHR funding. Has anybody already done that?
I'm on an NIHR grant at the moment.
Yeah, I knew you were. I didn't know if any of the partners. No. Okay, so I've tried to look at things that might be suitable for you here. So competition 5, research for social care, is open at the moment. And you can see there the aim is to fund topics and research methodologies that increase the effectiveness of social care services, provide value for money and benefit service users and carers. 14th of September is the deadline, but there's a webinar on the 28th of June on that one. I didn't know whether it may be worth a couple of you just having a look at our webinar to see if there could be any scope there for you in that one. The next one was the Health and Social Care Delivery Programme. So this funds evaluative research that has the potential to improve health and social care services and the way they are delivered. And you can see there research may be primary, secondary, and evidence syntheses. So mixed method studies on the organisation and quality of care. Now, quite a short deadline on that one, 19th of July, but not to say there wouldn't be calls later on along the same, the same programme. I thought that sounded, because it's actual delivery, I thought that may have potential there.
Yeah.
So again, I've put the link to that call there for you to have a look at. Can we go to number 7, please, Lisa? And then this was the last one under NIHR, research for patient benefit. The aim is to fund topics and research methodologies that increase the effectiveness of NHS services, provide value for money and benefit patients. Again, a short closing date on that, but not to say that there wouldn't be future calls as well. So I thought that sounded quite a practical sort of thing to be looking at as well. And research methodologies, can be included. So I suppose really it's patient benefit that we're looking at. Is that right? And how social prescribing benefits the patient, but also I suppose how we can make the service more efficient, isn't it?
I think in Wales we can't apply for it. Wouldn't be us, that would be the lead applicant for this.
Yeah,
we can be a
partner.
Yeah,
Yeah.
and the same with the social care one, because
Yeah.
we've got our own funds with
Yes.
Healthcare Research Wales.
I was just going to say, because we've got HCRW obviously, and yes, you're right in saying that this is NIHR, but I thought potentially some partnerships, because
Absolutely.
HCRW, given the breadth of the partners that we've got today on here, HCRW was probably a bit restrictive, isn't it? So so they were the NIHR ones I looked at. Can we move to number 8, please, Lisa? I think that's it then. I just wanted to mention this to you. You're probably all aware of this, the National Academy for Social Prescribing.
Yeah.
So they've got 5 million. But what it looks like on looking at this is they're very much looking at local community partnerships. But are you involved with them, or is that you are already?
NASPA are the National Academy of Social Prescribing based in England, and their funding comes from NHS England. So it's very much based in England as such.
Yeah.
So
this is the problem, I think, with it, with the fact that we've got NHS Wales, NHS England, and then we've got the Irish partners and Scottish partners as well. It is quite difficult, isn't it, to try to find stuff that is UK wide. Because everybody's dealing with their own sort of funding regimes, because you've had quite a bit from HCRW, Carolyn, haven't you?
Yeah, I have. Yeah, and I think Mary has had quite a bit as well, haven't you, Mary, in the past? And when she was at Bangor, Mary's at Scotland now.
Right. Okay.
So but I don't know what funding availability there is apart from the European stuff. Deirdre, I don't know if you got island specific.
Yeah, hi Karen. We would have, I suppose it could be a cross of some of those, but we have the Health Research Board. And they do different funding calls, but some of their calls is around kind of intervention development and testing feasibility of interventions. So that comes out every 2 years. So that's a possibility. And then we also have the IRC, so the Irish Research Council, which is similar to the European the ESRC, again very social science based, but again social prescribing fits well under that bracket and that category. So they do some small seed funding around research and developing those local kind of community research collaborations. And then the other source of funding would be the voluntary organisations. So you'd have things like the Irish Cancer Society, and they would put out calls around kind of, psychosocial improvements, quality improvements, service development for psychosocial related kind of post-cancer survivorship. So it is specific. So you get into like those voluntary organisations, the Irish Heart Foundation, the AWARE, which is more the mental health, one of the many kind of national mental health organisations. Again, they would have their own funding streams targeted at whoever are the users of their organisations. So there are possibilities. Yeah.
Would you say there that you've mentioned the Irish sources there? Would you say that funding would therefore be limited to purely the Irish partners, or would they look at, collaborations beyond Ireland? Because I think that's where the difficulty lies, really, isn't it? We've got the HCRW, you've got the Irish sort of part.
The HRB.
It's citing something that would allow you all to work together, isn't it?
Yeah, and some of the calls, Sue, they do say you can have international partners. And then some of the, others, they don't say you can't have them, but they don't specify, yes, you can. Yeah. So therefore, those ones really, like, as I say, the Irish Cancer Society or the Irish Heart Foundation, they probably are more interested in research that's going to benefit them.
Absolutely. You can see that, can't you? It's where they want their funding to be. So I think I've put as many links as I can in that for you to see if there's anything out there that may fit. But like I said, being honest from the start, I think it's fairly niche, and it's quite geographical the way things are being organised. And what I found as well is like there's a Health and Wellbeing Fund, that's another English one, but again they are looking at very localised community sort of interventions, rather than a collaborative research approach. So yeah, it is quite difficult, I'm afraid.
That's really helpful though, Sue, for us, to be able to understand the landscape. And I mean, it just means that we need to, as you say, go to things like the webinar on the 28th of June. Take a look at the ESRC and equivalents, and look at those UKRI mental health networks, and and keep an eye out really for the NIHR stuff, and anything as well on in Ireland and up in Scotland. But I know Mary's very interested in she's got a network up in Scotland now of researchers who are very keen to work with us in Wales, and also to work with colleagues in Ireland. So we've got a pool of people that we could draw on. I noticed that Sarah Jenkins she's from Cwm Taf Morgannwg Public Health, said possible answers as to why people don't attend the group services they are referred to is also probably due to behaviour change science, in which there is a wealth of research, and that's very true. But it's actually not been done in social prescribing. So that's I think we've got possibilities as to where we can focus our attentions. We just need to thrash them out, I think.
Yeah, of course. And obviously, if I see anything out there that I think may be suitable, obviously I'll pass that information on to you straight away. Obviously I'll keep an eye out for anything on it.
That's really, really useful. Thank you, Sue. Thanks for coming, and thanks for taking the time to do that. Anytime. I do appreciate it.
That's
Thank you.
okay. Nice to meet you all.
Thank you.
Yeah,
Bye.
thanks. Sue.
Bye-bye.
And
Bye.
there's not many of us left now, but hardcore. And so I suppose going forward, the question is, are we interested in having a further conversation about this?
Sorry, Carolyn, just before we kind of get into that discussion, can I just ask about any collaborations with NASP?
Yeah. I mean, I'm collaborating with Kerin Husk and Marcello Bertotti at the moment, and Joanne Goldthorpe, members of the collaboration there. And NASP are we're developing our national framework in Wales for social prescribing. We're a little bit behind yourselves. You've already got yours, but and NASP are on the ministerial task and finish group, so we have got relationships with them from a government perspective, but also you know, from as researchers, we're working on we've published on a global article most recently in BMJ Global Health, and we've also, as I said, mentioned, we've been working on editing a book. So we do have we have got the relationships there.
Yeah. They don't. Do they provide research funding?
No.
Oh, okay.
No. I mean, they're very much, NASP are very much practice focused, with and then they actually they ask certain researchers to do work for them. So Mary Polly very much part of that, and developing those you know, the summary of evidence and so forth. So they've got certain people from Westminster and University of Westminster and other universities in England.
Okay.
So I suppose going forward, would you be interested in having further conversation around this? You know, possibility of doing some work around this area, this topic area.
In terms of why people fail to engage.
Perhaps. Yeah.
I think it would. You know, it's easier. You know, some of the other topics, you know, in terms of looking at the effectiveness of it, some of those might be harder to do on a kind of a cross collaboration way. Whereas something like that, you know, why people fail to engage, I think that might be just easier to manage logistically. Yeah.
I think if we could identify some seed corn funding, we could do a small piece of work in order to sort of build a foundation for a larger submission.
Yeah.
You know, maybe something with elemental, maybe, or regarding some numbers, but also some qualitative work.
Yeah. It's also going back to no, look, sure, like I'm thinking more design and logistics now, as opposed to, you know, starting going through my head. But I think that, you know, as I say, the figures are high in terms of people not attending. So, you know, there is a big area there that needs to be looked at. Why? And I think that brings in some of what, you know, Mary Lynch there talking about the whole idea of, do people know enough about what social prescribing is? And I think that's an element of why maybe people don't attend. And also healthcare professionals. What's their understanding, and do they promote it?
And I think you know, I'd be very interested in that topic area. You know, why is it that we're so hung up on it as a certain section of society, researchers and service deliverers, but actually the engagement with the public has been minimal.
Mm,
There hasn't been any sort of public broadcasting or anything of that nature, social media around.
no.
So how do we expect them to know about it?
Yes. Yeah. And then what would that broadcasting message be? And in order to get the understanding across, because I do think that's part of the crux as well. It's a funny terminology, social prescribing.
Yeah.
And so, do you try and move away from that language altogether? So yeah, the terminology used to get that message across would be really interesting to look at. So yeah, I think there's loads of potential there for sure.
Can we suggest that maybe we could meet up again? Maybe at the beginning of September would be best now because of the holidays coming on.
Yeah, I think that's a good idea. Yeah, maybe, or I'm away early September, maybe more into the middle of the month if that works.
Yeah. So Lisa, could you ask the hardcore, obviously some people are at the meeting today, but there may be others that are interested to meet. And it may be just it's a small group of us, but to meet first to have a conversation regarding social prescribing and maybe this question why some people fail to engage in the activities to which they've been referred.
Yeah. Sorry, Lisa.
But not limiting it to that, but that's loosely where we're going. That'd be great. All right, well.
Yeah, I could just to say, I suppose, I think I was saying before, I'm part of the All Ireland Social Prescribing Network, and we have a research and evaluation subcommittee. So they could, the other members would be interested in joining a call in September as well, just to kind of discuss. And we have some people from, from Queen's in Northern Ireland as well, Carolyn. So that will again
that would be great.
Extend the group a bit.
Yeah. All right then. That sounds like a plan. And thanks everybody for coming, and I hope I certainly found it interesting.
Yeah,
it's been interesting 3 meetings for sure. Thank you everybody, and have a good week.
Likewise. Have a good summer.
Bye. See you in September. Bye. Bye.
Bye.